Bismillahirrahmanirrahim. Assalamu alaikum. The topic which we are going to start today is disturbances in structure of enamel. Now, the first is acquired disturbances. Disturbances in the structure of enamel can occur as a result of environmental factors or hereditary factors. Among the environmental factors are bacterial infection and viral infection, examples syphilis, scarlet fever, etc. Inflammation, nutritional deficiency, for example, vitamin A, C, D, calcium deficiency, chemical injuries, example, fluoride, and trauma. Depending on the causative factor, the enamel disturbance may be localized to one or two teeth, that is focal enamel hypoplasia, or it may affect many or all teeth, that is generalized enamel hypoplasia. The extent of the enamel defect is generally related to the specific causative factor, the duration of the injury, and the stage of enamel formation at the time of the injury. Enamel defects resulting from environmental factors usually affect either the deciduous or the permanent dentition, but seldom both. Unlike hereditary factors that usually affect either the enamel or the dentine, enamel factors often damage both types of hard tissue. Focal enamel hypoplasia. Localized or focal enamel hypoplasia involving one or two teeth is relatively common. As you can see in the picture, it is involving incisors with canines. Although the cause is often unclear, that is idiopathic, in some cases it is readily apparent. A common form of focal enamel hypoplasia of known cause is Turner tooth, which results from localized inflammation of trauma during tooth development. So, a typical example of this phenomena occurs when a deciduous tooth develops a caries or trauma-related abscess, and it damages the underlying permanent successor. And in depending on the severity of the injury, the affected crown may have an area of enamel hypoplasia that is relatively smooth, white, with pitted areas, or is grossly deformed with a yellowish brownish discoloration. Here you can see it is grossly involved with the yellowish or brownish discoloration. Now, the next is generalized enamel hypoplasia. Short-term systemic environmental factors inhibit functioning ameloblast at a specific period during tooth development and are manifested clinically as horizontal line of small pits or grooves on the enamel surface. Yeah, like this. Sorry. Like this. Small pits or grooves. Brown in the enamel, on the enamel surface that corresponds to the time of development and the duration of the insult. If the duration of environmental insult is brief, the line of hypoplasia is narrow, whereas a prolonged insult produces a wider zone of hypoplasia and may affect more teeth. Knowledge of the chronological order of tooth development is helpful in determining the approximate time of injurious insult. Clinical studies indicate that most cases of generalized environmental hypoplasia involve teeth that are formed in infects during the first years of life. Thus, the teeth that are most common often involved are the ones which are developed first, that are the permanent incisors, cuspids, canines, and first molars. Premolars, second molars, and third molars are seldomly affected because their formation does not begin until the child is 3 years of age or older. Now, the enamel hypoplasia can also result from congenital syphilis. It that affects this the third picture in the bottom on the bottom is the person which is affected by congenital syphilis. It affects the incisal edges of permanent incisors, and here you can say the occlusal surface of the permanent first molar. The notched screwdriver shaped incisors are termed Hutchinson's incisors, whereas the globular occlusal surface of the first molars are termed Mulberry molars. Not all patients with congenital syphilis exhibit the hypoplasia. Hypoplasia. In addition, occasional patients who have no history of congenital syphilis can exhibit changes that are indistinguishable from Mulberry molars and Hutchinson incisor. A diagnosis of congenital syphilis should therefore be made only after conclusive evidence is available. Now, there's enamel hypoplasia can also result from hypocalcemia secondary to vitamin deficiency. It is usually the pitted type. The pits are formed on the surface of enamel, crown of teeth. It is clinically indistinguishable from enamel hypoplasia caused by disease such as measles, chickenpox, scarlet fever, and by vitamin A and C deficiency. So they are one or the other same. The neonatal line that can be seen microscopically in non-decalcified ground sections of deciduous teeth and first permanent molars can be considered a mild form of enamel hypoplasia and is indicative of systemic insult to the teeth during birth. Clinical studies also indicate that enamel hypoplasia is more common in premature born children than in those that are born at normal term. A well recognized example of chemically induced generalized enamel hypoplasia results from the ingestion of fluoride. Although total fluoride intake will vary with total water consumption, fluoride induced enamel hypoplasia, which that is also known as fluoride mottling, is usually evident is usually not evident in patients at levels below 1 ppm in the drinking water parts per million. With an increased amounts of fluoride in the drinking water, the resultant enamel hypoplasia becomes progressively evident. This picture shows the person who is exposed to the water with increased fluoride levels. Because increased fluoride levels interfere with ameloblastic function, which adversely affects both enamel matrix formation and enamel matrix calcification. Clinically, minimal fluoride mottling exhibits a smooth enamel surface with occasional subtle whitish flecking. Mild mottling exhibits a smooth enamel surface with opaque white areas, and moderate to severe mottling exhibits varying degrees of obvious pitting and brownish discoloration of enamel surface, as you can see in this picture. In severe fluoride mottling, the enamel is considerably softer and weaker than normal, resulting in excessive wear and fracturing of the incisal and occlusal surface. Conventional restorations are therefore difficult to retain. Regardless of the degree of fluoride mottling, affected teeth are largely resistant to dental caries. That's all for today. Next, we will do amelogenesis imperfecta. Aslam.